It's the #1 killer of men and women in the Western world. In the United States, it is responsible for 40% of all deaths, more than all forms of cancer combined. Cardiovascular disease.
Cardiovascular disease includes heart attacks, strokes, heart failure, peripheral vascular disease, high blood pressure, and dilated blood vessels called aneurysms which may rupture. In essence, anywhere in the body that the blood goes, there can be a diseased blood vessel.
Cardiovascular disease may have no symptoms, but shortness of breath, dizziness, fatigue, increased heart rate, and chest, arm, or leg pain are signs to watch for. Diagnosing any cardiovascular disease is uniquely challenging.
You know, the symptoms are subtle, so we have to have a high degree of suspicion and use our history, physical exam, and specialized blood tests to good advantage. And then we bring in specialized tools such as CT scanning, MRI where you're in the big magnet, as well as traditional heart cath angiography to make a diagnosis.
While deaths from cardiovascular disease are declining with advancements in treatment, more and more people are at risk for developing it.
Top risk factors include smoking, high cholesterol, and high blood pressure. Also diabetes, obesity, and lack of exercise and stress. At the Center for Health, we have effective and powerful programs that address all these issues. In fact, if we can get people early enough into our programs, we can prevent heart disease altogether. If someone's already had a procedure on their heart or on their blood vessels, we can prevent problems down the road.
When plaque in the arteries builds up, it compromises the blood flow to the heart. Cardiac bypass surgery is the gold standard for treatment when more than one artery is involved. Traditionally, a heart-lung bypass machine takes over the pumping action, allowing surgeons to operate on the still heart. This procedure carries risks as well as rewards.
Benefits of heart surgery include living better through relief of your symptoms and living longer by avoiding a premature death. Of course, all surgery has risks, just like driving your car is risky or taking a commercial airline flight. But what perhaps most people fear more than dying is the complication of having a stroke.
In advanced heart centers, surgeons use new devices like the heartstring to further reduce risk of stroke.
Off-pump bypass surgery is a highly advanced procedure that improves outcomes and decreases mortality and complications compared to traditional bypass surgery. At St. Helena Hospital, the majority of bypass operations are done off-pump with a heartstring device.
Most people don't know that the same disease process, atherosclerosis, also causes blockages in other blood vessels throughout the body. It's called peripheral arterial disease, or PAD. PAD restricts blood flow to the brain, kidneys, legs, and feet. 25% of heart patients also have PAD. The most common symptom is a painful cramping in the hips, thighs, or calves when walking, climbing stairs, or exercising. Others include foot wounds that won't heal or heal very slowly, or one leg or foot that's colder than the other or than the rest of your body. A simple painless test called ankle brachial index, or ABI, can screen for PAD.
I was experiencing a great amount of pain in my buttocks and along my leg, which we thought was sciatica. I like to move around a lot and I like to ride horses, and the pain was getting so that I couldn't do that any longer. I went to have it checked, and the doctor discovered that I had no pulse in my right leg, and with a CT scan they found where the blockage was.
Untreated, PAD can lead to loss of a leg or toes and increased risk of heart attack and stroke.
Ron was taken to the cardiac catheterization lab. He was mildly anesthetized. Through his groin, we inserted a wire and then a catheter. We injected some dye to further delineate his anatomy. And then we inserted a stent, inflated it, thus restoring circulation down his legs. Shortly thereafter, he was walking.
When it comes to caring for your heart, you only get one chance. St. Helena Hospital in the world-famous Napa Valley is a leader in cutting-edge cardiovascular care. St. Helena Hospital is the only hospital north of San Francisco that offers minimally invasive procedures to open up the tiniest vessels in the legs and repair aneurysms in the largest blood vessel in your body, the aorta.
Some of the more exciting developments in the treatment of cardiovascular diseases is the use of stents, stent grafts, angioplasty, and other new technologies. For instance, we utilize the Silverhawk device, which is essentially a planer that allows us to shave through plaque and calcium deposits in peripheral vessels. In addition, there's a new device that utilizes ultrasound waves that are able to pulverize calcium deposits that completely obstruct peripheral arteries. In doing so, we're able to obviate the need for bypass surgery.
With 130 years of promoting wholeness in healthcare through technology, lifestyle management, and spirit, St. Helena Hospital is at the forefront of cardiovascular prevention, diagnosis, and progressive minimally invasive intervention.
It's an expression of our commitment to whole person care, body, mind, and spirit. St. Helena Hospital has a legacy of quality and excellence in cardiovascular care. It began more than 30 years ago when we were the first and only hospital north of San Francisco doing open heart procedures. We are committed to staying on the cutting edge now and in the future.
St. Helena Hospital is a vibrant community hospital that also serves as a regional heart and vascular center. Its accomplishments and its quest for excellence are an ongoing passion for its doctors and specialists.
I'm very proud to work at St. Helena Hospital. People come from all over to receive exceptional care here. From physicians to nurses to other staff, we have created a wonderful heart and vascular center.
Widely recognized as a leading cardiovascular center in the North Bay, St. Helena Hospital consistently takes top honors in patient outcomes and satisfaction.
I really can't say enough praise for the people at St. Helena Hospital and their excellent follow-through. I had bypass surgery done 4 years ago and PAD surgery done a year ago, and I've never felt better. It really made a difference in my life.
Doesn't your heart deserve the best? To find out more about St. Helena Hospital, contact them today or visit sthelenahospital.org.